y'all. Can y'all believe, as y'all can see by the title, that I am doing my 2-year update? Like, if y'all been following me from back then, when I was in nursing school, just getting my ADN. What is this on my ear? When I was getting my ADN, like, y'all know the journey, the struggle. Like, if you learn nothing else from my journey, is to trust the process, because literally I started from the bottom, like no background in the medical world. Like, I literally started fresh, and look at me now. Like, I'm 2 years in. Well, at the time that I'm doing this video, it's like 2 years and 3 months, but you get the gist. Like, I have progressed so much. Like, I can't even believe that I'm doing a video talking about my 2-year like update and review and what I've learned thus far. But we're gonna go ahead and get into the video, because you know I don't like to talk y'all head off. But first, I wanted to go ahead and give you guys a little bit of information about myself, because I have a lot of new followers, which I'm so thankful for. Thank you guys for coming and kicking it with me, rocking with me. But I get a lot of the same questions, because a lot of y'all did not follow me from way back when. Probably like 4 years ago when I started nursing school. So let me just give you guys a little bit of information about me, so you kind of understand my journey and where I'm at and how I got here. All right, so first of all, I am 34 years old. I say that because I get a lot of questions about, is it too late for me to start? I'm too old, or this would be my second career. Is it worth doing it? And let me tell you, yes. I went into this as my second career when I was 30, I believe. That's when, yeah, I started nursing school. And when I was in my classes, like, there were people who were like 50s, 40s, grown kids, little kids, married, single, divorced, whatever. Like, it is never too late. I am so thankful that I did make the conscious decision to say, okay, let's switch careers, because nursing has been by far like the best decision that I've made for myself. So if you are thinking that you're too old, you're not. If you're thinking that you don't have it, you do. Will it be hard? Of course, especially if you have a family and things of that nature. I didn't have any kids, but I had to work full time. A lot of people ask me that as well. Did I work full time when I was in school? And yes, I did. The bills had to be paid. I wish that I didn't have to, but I did. So if I can do it, anybody else can possibly do it. So don't discount yourself. Another question that I get, or I'll just run it down. So I went to school in Florida. I went to Rasmussen. It's a private school. It took me about 17 months to finish my program. So I have been a registered nurse, as I said previously, for 2 years. Well, I guess technically I count the day that I actually start working in the hospital, not the day that I pass my NCLEX. But in May of, it's 2021 now, so 2019 is when I actually started working in the hospital. And a lot of people also ask me as well, when did I start travel nursing? And I started travel nursing at 17 months. It wasn't a full 2 years. Typically they like a year or two, but as I say all the time, I tell you guys all the time, it just depends on you being confident in your skill set. I think they say that because it takes about 1 to 2 years for you to be confident. But they say that because when you start doing travel nursing, they're not going to baby you. This is not the time to train you how to do anything. They want you to get on that floor and go. You will get maybe 1 to 2 days of training. 3 if you really like, if it's like a lot going on and you just feel like, nah, I need that extra day. But typically it's like 1 to 2 days, and they expect you to hit the ground running, because you're there to meet a need. They're not there to train you how to be a nurse. They are expecting you to know that already. So I always say, be very confident in your skills, be able to take care of the sickest person on your unit, and you should be fine and ready to travel. And obviously you need hospital experience if you're going to be working in a hospital, because working like in a nursing home or long-term care facility or like an office, that is completely different from the hospital setting. And so you want to kind of have an idea of what you're getting to before you go there. You don't want a travel assignment, if they even take you, to be your first experience working in a hospital. You kind of want to have that under your belt and just see how things move and groove before you actually get there. So I believe that's pretty much it about me. If I forgot anything, I've said the school that I went to, I said my age, I said that I'm a registered nurse, I got my ADN first, then I got my BSN. Oh, my specialty. So the whole entire time that I was, before I started traveling, my specialty was a cardiac tele nurse. But as I started traveling, they kind of just floated me everywhere. I did PACU, I did ortho, I did like pre-op, like I did pretty much everything. I still do get the opportunity to work on cardiac floors, and that is my specialty, but I'm just basically like a med-surg nurse. Not I don't want to say nothing special, but like I'm just a med-surg nurse. The first thing that I've noticed once I hit my 2-year mark is that it does get better. You know, in my last video, I'll put it right here so you guys can check it out after you finish watching this one, but I talked about just being so overwhelmed, so anxious, feeling like you're going to kill your patient, feeling like you don't know anything, just feeling like you're really not adequate enough. And let me tell you, it gets better. I still get anxious, I still am nervous, I still feel sometimes like I don't know what I'm doing, but I guarantee you right now, like, I know a lot more now today than I knew then, and my confidence has built up. That's the thing I think we don't realize, is that the more we do nursing, every day that we go to work, we are adding to our confidence. Like, repetition is key. So the more that you do something, the more that you're in an environment, the better you'll feel about that. And I can definitely say that has also improved with travel nursing. One thing about staying in one hospital is you only get to see what they do. With travel nursing, every single hospital I go to, like, nursing is nursing no matter where you go, so you don't have to worry about that, but you really get to see how people maneuver, how they handle things, their policies, their procedures. Like, you get a variety of things, and that also has built my confidence as a nurse too. So my first travel assignment, I'm working on my 4th one now, and I'll still be nervous because I'm going into a new environment. I'll be with new people. I have to learn new policies and procedures. Like, that still creates a sense of anxiety for me, because I'm the type of person, like, I am very comfortable in what I know. And you guys know with nursing, there is no comfort zone. Like, things are always changing. And for me, like, I like things to be the same, which is so weird that I'm a nurse, but I've adapted. But I like to get to that point when I start my first assignment, like, that first week is filled with a little bit of anxiety, nowhere near when I first started, but it's just like coming into a new environment, and that's completely normal. But after that second week, I'm good. So I just want you guys to know that it does get better. You're not going to be anxious all the time. You're not going to have this anxiety or this cloud of doom or feeling like you don't know, feeling like you're not adequate enough. Like, that does get better over time, thankfully. Another thing to go along with that is that I noticed that I'm not as stressed anymore. I guess, like, in the sense of, like, if my patient was kind of like going downhill or there was something wrong, like, it would just be this full on, like, oh my God, what do I do? And now I don't really feel rushed to do anything. Like, I think that I've gotten to the point where it's like, if my patient, say they're not breathing well, like, now I know the steps to take to kind of troubleshoot that problem and get them to where I want, versus before when I was a new nurse. Like, that's what it is. My critical thinking skills have advanced. Now I know what to do in certain situations, so I'm not as stressed. You know, if a tech come and tell me, hey, the blood sugar was like 54, I'm not like frantic, like, oh my God, it's 54. It's like, okay, did you go ahead and grab them some juice? Let me go in there and check, make sure they're not symptomatic or anything like that. Check that blood sugar in 15 minutes, let me know. Like, things become easier, tasks become easier. If you know somebody's oxygen is like 87, 88, go throw them on some oxygen. If they are already on it, turn it up. Say it can't be turned up, let's switch to an hour breather. That was another example that I used in one of my vlogs that I was talking about. Like, I'm noticing that my critical thinking skills are developing, and it feels so good. Like, I feel like I'm at that point of being a nurse where I feel like I'm confident. Not confident in the sense that I cannot be taught. Let's not get it twisted, because you are always learning as a nurse. But I feel confident in saying that I can recognize something and know what to do about it. And if I do not know what to do about it, I know what resources to use to figure that out. One thing about me, I tell you guys all the time, I have no problem asking questions about anything. I don't care if it sounds stupid I don't care if once I get the answer, it's like, duh, because I have somebody's life in my hands, and I always rather have a second opinion than to not say anything and let just something happen by chance, or God forbid, you know, the patient gets injured or dies, or I just don't want that to be on me. So I will ask 2, 3, 4 people about something if I don't get it or I don't understand. And it's always good to have another nurse's perspective on something. And that's one thing I can say, is that anytime I've asked questions, even if they are stupid, most people, they understand that you're new and that they were new as well. And so I haven't really had the experience of people making me feel stupid or making me feel like I'm not adequate enough. But that's one thing I'm gonna do. I'm gonna ask questions. So I am not as stressed as a nurse as I've progressed. Like, I kind of can like handle my load. Like, I'm good. Like, I could come in and feel like, it used to be like before, I would be so anxious and filled with anxiety before I came on my shift because I didn't know what the day was going to bring me. But now it's like, it's expected. I still don't know what the day is going to bring me, but I know I'm going to make it through. No matter if my patient cold or, you know, my patient go downhill or whatever the case may be, I have really developed my critical thinking skills, and I know how to troubleshoot stuff. So as you go, as you work, your skills will develop. You won't be as stressed, or at least you shouldn't be. You will still have stress because it's a high intensity environment. You have somebody's life in your hands. Somebody is sick. Like, it's a stressful environment no matter what. But you'll get to that point where you don't feel that anxiety before you come into work. Hopefully you don't. I know that I don't. Even working in these different facilities with different people, knowing that they're going to be short-staffed, it's kind of just like, I know I'm coming here to do my 12 hours and I'm gonna keep it moving. So that's another thing I wanted to say. Like, over time, you won't feel as stressed. So this one, I don't know if it's because I'm an empath and so nursing tends to hit me a little bit differently, but I definitely recognize that nursing is a lot. It is a lot mentally, physically, and emotionally. And I had to learn really quickly that there has to be a balance. Work has to be work. I am not one of those nurses, unless I absolutely have to, but because I work night shift, 6 times out of 10, I have the time to catch up on whatever I have to. But I'm not one of those nurses who are going to stay over. I'm not one of those nurses who won't take her PTO time. I'm not one of those nurses who will not call off when she's sick because she feel bad. Like, with nursing, you really have to take care of yourself first. And as nurses, I think we kind of lack in that department because we are so used to taking care of everyone else, our family members, our patients, that we don't realize if we are not taken care of, we can't give our all to our patients or to our family members. And so I learned very early on that I have to really scale back and separate myself. When I'm at work, it's all about you. I am a nurse 1000%. But the moment I clock out, I'm not a nurse. My name is just Shannon, and I keep it moving, because dealing with death, dealing with just sickness, you become people's therapist. You know about their whole entire life story, their family dynamics, the drama they got in there. That takes a toll on you. Like, you are one person taking all of this from your patients. And I had to really detach myself. Not in the sense that I don't care about my patients. I care about them. I advocate for them. I educate them. Like, they are my priority when I am at work. But if I am not feeling it, if my personal life is too out of control, I'm going to take some time off. If I don't feel good, if I got a headache, I don't care if I'm on my period, whatever, I'm going to use my sick days. That's what they're for. I am going to take a vacation. I am not the girl who was racking up her PTO to pay it out. No, it's getting used, and I'm going to take a real vacation. I'm going to go somewhere, and I'm going to reset and recharge. And so I had to learn that nursing is a lot. It's a lot on us mentally, physically, and emotionally. We take on so much. It is a very high stressful job. Like, you are dealing with people's lives, and that is serious. And I don't think in nursing school, I don't really think it connected with me. Damn, my battery about to die. I don't think it connected with me. It was kind of just like, okay, I'm gonna do this job, I'm gonna take care of these people, and I'm gonna keep it moving. And it's just like, no. Being a nurse really taught me to value life. It taught me to value my health. It taught me to value just being able-bodied to do things. Some people can't walk, some people can't talk, some people gotta go dialysis every day. Dialysis is a lot. And so I have really started to recognize how blessed I am. Not saying that those people aren't blessed, but just being grateful for the fact that I am able. I'm able to talk, eat, sleep, move around all on my own with no type of extraness. And I think we take it for granted because when you have it, you don't even really recognize it until it's taken away from you. And so I always try to practice gratitude. If nothing else, being a nurse has taught me to be grateful for everything that I have, even the minor things, because there is somebody who doesn't have it. There's somebody who wake up every single day with a level 10 migraine and they can't even function. And it's just like, I really have learned to be grateful for what I have as a nurse. My patients have taught me so much about my health, so much about myself, so much about life. And you start to really notice that as you become a nurse more and more, you continuously see these sick people every single day. And honestly, it can be very depressing. I remember when I came back from Miami this year, I didn't been to Miami like 5 times, but when I came back from Miami this year, I felt so refreshed. And the moment I walked into that hospital, it was just like I felt drained. And I was on a good assignment, but it was just because being with sick people day in and day out, like that is draining on you. Like seeing people die, seeing people get these, I feel like this year I've seen so many people get the prognosis of like, you have cancer. Like they felt sick and then they go in, find out they have cancer and find out that they only got a few months to live. Like that aspect of nursing can be very draining. Yes, it is the good side where people get better and then they go and then they don't come back. But honestly, we live in a very sick country. That's few and far between. There are more sick people out there, honestly, than it is healthy people. And that's just the reality of it. And that reality can be very draining. So I can definitely say within my 2 years, I learned that I have to take care of me because nursing is a lot. Physically, mentally, emotionally, you have to take care of yourself, because if you start to let all that stuff weigh on you, it's gonna bring you down. Like stress will kill you. It will make you sick. And so I have definitely learned in my 2 years to take care of me first. I am my first priority, because if I am not there, and understand that you are replaceable too. If you die, they'll find somebody else. So if I am not taking care of myself, I am good to nobody. So that is what nursing has definitely taught me in my 2 years, to take care of Shannon first. To kind of piggyback off of you won't be as stressed, also with not being stressed, like things start to finally click. I don't know everything. Some stuff I'm still confused about. I start to understand diagnoses and what is the care plan for that diagnosis. I know we do it in school and we hate it, but if I had mine, I threw all my nursing school stuff away. Like I was done with it, except for like my books, my homework and stuff. I'm like, I don't want to see that stuff again. That's how traumatized I was from it. But you start to see how things piece together. Like they start to make sense as you go along in your nursing career. I can definitely say, like, especially when you have a specialty when it comes to the heart, and I'm going to do like a cardiac video for you guys, but you know when somebody comes in with chest pain, or they come in with an STEMI, or they have high blood pressure, or they're in fluid overload, you pretty much know what the treatment plan, what the care plan is going to be for them, whether it be they're on a heparin, or they go into the cath lab, or they on a nitro drip. Like you know what some symptoms are, and you know what to do to mitigate them. You already know the orders that the doctors are going to put in. Like it starts to make sense in that aspect. In the beginning, I would kind of just be doing stuff because the order was in and that's what it said to give. Now I can kind of see when something is not right. Like I told y'all that in my last vlog, how I was giving somebody heparin who didn't need it. I think when I first started off, and thank God that you go through training and you have a preceptor, but I probably would have just hooked up the heparin because there was no correlation to me of why somebody would be on a heparin or what it would be needed for. I would just have trusted what the doctor was putting in and kept it moving, and somebody probably would have corrected me later and I probably would have felt horrible. But I definitely noticed now I get things. I don't get everything. There are some things that I just be like, I don't understand it, or some things that I just don't really come across. But for the most part, like, things are finally starting to click for me. I can talk to my patients and tell them, like, this is what you should expect while you're here. Or when the doctor does come in and talk to you, these are the things that they may talk to you about, because now it's familiar to me. Like, now I've worked with enough patients where I know this is what's going to be done for this, that, and the third. So it does get to a point where things start to finally click and you are not feeling like you're just kind of doing things. It's like you just passing meds and you just fulfilling orders just because, like, it's not making sense to you. But I'm telling you, the thing about it is experience. The more you work, the better you get. The more you understand stuff, the more you see stuff. And so it does get to a point, I would say like my year and a half mark, honestly, right before I started traveling. That's when I was like, is that a year and a half? I don't know, but around that time is like when things really started to click for me. All right, y'all, so my camera cut off, so if the angle looks a little different, it's because I had to switch to my phone. Don't mind it. So the next thing I wanted to get into is that I feel like when we were new nurses, I mean, obviously I'm still a new nurse. I'm still a novice nurse. I do not consider myself an expert. But I feel like in the beginning, it wasn't necessarily harder for me to speak up, but I wasn't confident in what I was speaking up about. And so I feel like as my time has grown as being a nurse, I have definitely become more confident in advocating for my patient. If my patient doesn't understand the procedure that they about to go down for, I'm going to call the doctor like, hey, come talk to them. They are having some concerns that I don't feel comfortable talking to them about because I'm not a surgeon. If my patient is taking a medication that they don't feel like they should be taking, or they feel like it's making them feel a certain way, I feel so much more confident advocating for my patients. I think a lot of it was because I didn't know anything. Not saying that the doctor is always right, but it's just like, go with what the doctors say. They know better. But as I've gained experience, I've seen different things. I've seen how people react to different medications, how it makes them feel. I've just been in a lot of different situations that have given me the confidence to say something is not right. Or even a lot of times too, like, say for instance, somebody has like high blood pressure, or somebody is just like off. A lot of times the doctors are busy and they can kind of just not blow you off purposely, but they have a lot going on. So if it's not like an urgent matter, it's understandable how they can kind of just, oh, I'll get to it when I get to it. But sometimes you have to let them know, like, no, this needs to be done right now. You need to put an order in right now. You need to come see this patient right now. And granted, use your common sense, because every situation doesn't cause for a right now moment. But sometimes you really have to put yourself in that position to advocate for your patient. I feel a lot more confident talking to doctors about a patient. I have a lot of doctors, like, for the most part, doctors are good. You will find doctors who are like, just don't have good bedside manner. But for the most part, most of them understand that we do the damn thing. Like, we run this hospital. Without us, there is no them. They understand that we are needed. And a lot of times, a lot of them do respect you. They respect your opinion. I've had doctors come up to me and ask me, what are your thoughts on this? What do you think? And I'm thinking to myself, like, you the doctor? But you know, like, they have that type of relationship with you where they value your opinion. And so I think as you gain more experience, when you start to see things, you won't question it. in a sense of like, should I or should I not say something? You get to the point where you like, I'm going to say something. Something needs to be done about this. And not all the time will a doctor do what you're asking or, you know, I guess resolve an issue that you're seeing, but make sure you just document it. Make sure that you put it out there, that this is what you had seen, and that's all you can pretty much do. But I do definitely think as you start to gain experience as a nurse, as I started to gain experience as a nurse, I have built up my confidence. Definitely as I've grown as a nurse, my confidence to advocate for my patients and even just talk to my patients in a way to get them to see like your health is important. You need to take this serious. Has definitely grown as I've grown as a nurse. I think I realized this really early on, but I really speaks true now that I'm at my 2-month mark, is that you will always be learning. You will not know it all. And that can sound daunting, but it's meant to encourage you, because even the veteran nurses, the ones who have been doing this for 30 years, nursing is always changing, always. They don't even know everything. And so always be a student. Don't ever get to the point where you feel like you know it all. Like, oh, I got this. Like, I know what to do. Even when I know what to do, I still always listen like I don't know what to do, because you just never know what new information may pop out at you and be like, oh, okay. Like, I'm always going into this, like I said, as a student, always learning, always progressing. You will not know everything. And that gives me a type of comfort, because y'all know in the beginning, you get so anxious about the fact that you feel like you don't know nothing. And so you get to a point where you know a little something, but it also feels good to know that you won't know everything. You will not ever get to a point where you've arrived, and you will get to a point where you have more experience and you know how to maneuver around certain situations. But because we are dealing with human beings, we are dealing with medicine, you're not gonna know everything. Research is always evolving, improving. Policies are always changing. You always will not. You just won't know everything. And so I definitely realized that. I've definitely realized that in my 2 years, that you're not going to reach to a point where you arrive. You will reach to a point where you get more comfortable and more confident in your skill set. You will get to a point where, you know, your critical thinking skills develop. You'll get to a point where you're not as stressed, where you're comfortable, but you will never get to a point where you know everything. It's just impossible. That was like one of my biggest things, learning how to communicate. I don't think communicating was really an issue for me, because I know how to communicate. It was more so delegating, feeling like, oh, I could just do it. It'll be quick. I can do it. But you don't understand like how many things you think can be quick that turn into something that's not quick. And then now you didn't got off track and you've gotten behind. So learn how to delegate appropriately. I think that's the biggest thing. If y'all having a chill night, or you know it's something that can be done, delegate it. If it's something that you can get done quickly and you caught up on all your tasks, go ahead and do it. Don't think that you're too good to pull a patient up or get a patient to the bathroom or empty out a drain or a Foley. And a lot of times I just like to do the stuff because I want to see how my patient walk. Let's get up and go to the bathroom because they told me you was a 1 assist, and now I come to find out that you a 2 max. Let me empty out that drain because I need to monitor how much you have been putting out. Let me make sure that you good and you went to the bathroom because you just got your Foley pulled, and we need to make sure. Like, a lot of stuff I don't mind doing on my own because I want to know. I want to know about my patient in detail. I don't want to rely on somebody else telling me. But a lot of times I can't get my patients up. Sometimes I have to let the tech know, hey, somebody just called for a bathroom. Can you go handle that? Sometimes I don't have time to always empty the Foley right before the whatchamacallit. Hey, I see you didn't do that. Can you go handle that? But I think it's the way in which you say things, and I think it's very important that you communicate early on. I always, for the most part, touch base with my CNAs and my techs at some point during the shift. Maybe not at the first beginning because we got a lot of stuff going on, but once things die down, I either go find them, or a lot of times they come and find me, and we kind of just go over what is expected. What do we need for this patient? What are we watching out for this one? What do I need to do on this one? Communicate, delegate. I have done really well at that because in the beginning, I wasn't the best at it. So as I've gotten better, I've learned that it helps me to delegate than to feel like, oh, I can just handle it all, because baby girl, because you can't. You cannot. Like, it's impossible to do everything. And so, y'all, that is the end of the video. I don't think I missed anything. I mean, honestly, this was just me reflecting on what I've learned thus far in my 2 years and how I've grown as a nurse in 2 years. And so you guys let me know, does any of this resonate with you? People who are kind of on the same journey that I am, as far as like the newness of us being nurses, and you've already hit your 2-year mark or you're coming up on it. Like, what are things that you are noticing about yourself as a nurse? If you guys have any questions, you always know I love talking to y'all in the comments. Hit me up. I hope this video was informative and helped you guys feel better just about the process of being a nurse, because it is a lot, y'all. It is so much. It is stressful, but it is definitely rewarding. It is definitely a good career path to choose. I do not regret it, but it definitely also comes with a lot. It comes with so much, and a lot of it you really don't even know until you are on that floor being a nurse. So that is it, and until next time, I will talk to you guys later.